everyone, my name is Mary Janica Tan, and by the grace of God, I just recently passed my NCLEX. It still feels unbelievable to say that I am now officially a registered nurse. And I did it with the help of a very brilliant tutor, Dr. Peter Morante. I started as a negative thinker who was full of fear, but then I changed my attitude about it and I enrolled to his NCLEX bootcamp, and Dr. Moranta trained me to stay positive, to work hard, make it happen, and get that yes, yes, yes. So with the training and resources he will provide, you'll be golden. But of course, you have to do your duty to study and manage your time. Surround yourself with a good support system and study smart with Morante Associates. Combine it with a positive mindset and you'll achieve anything you set your sights on. If I can do it, you can do it too. Good luck.
And I just wanted to share how grateful I am that I joined Dr. Peter Morante and Associates NCLEX Bootcamp. I wouldn't have achieved my goals without them. Their tools were really useful. That includes the Zoom classes, the PowerPoint, and testing strategies, Kahoot, assessments. So I utilized them all and passed the NCLEX. And I think I joined like 11 or 13 sessions, including the last one that I still attended the day before my NCLEX. We also did a lot of Kahoot questions, which was really challenging but also helpful because it was quite similar to the actual NCLEX exam. It was short and vague. So yeah, overall, I just wanted to thank Morant and Associates for everything. And if you're looking for a solid and a really good NCLEX review, go for Morant and Associates. You won't regret it.
Proud of you. Okay. And you finished the exam in 25 minutes? Oh my God.
Yes, yeah.
It means you're doing it correctly. That's the reason. I did it really well. Proud of you. Okay.
Thank you.
Great. You passed the board. Ready to roll and be one of the best nurse. Happy Nurses Week to us, right?
Yes.
I'll have some good time with you. How many questions did you?
I got 85.
85.
And then
Oh,
it
then you're
closed out.
smart. That's the minimum.
Yeah.
Okay.
Di ko alam kung pumasa ako eh. Tapos the next day I got the email.
I got
Malam,
the
like,
quick
I didn't
results.
even know I passed. The school emailed me first. And they're like,
Oh, the school know already?
Yeah.
Welcome. Congratulations on passing your NCLEX. Marisa Franco, right?
Yes.
How was the NCLEX experience? Was it so easy for you?
It wasn't bad.
Any advice that you want to give our ESN students or anybody that will pass the NCLEX?
I think it's learning how to answer NCLEX-style questions. I feel like throughout nursing school, everything was more, not textbook-based, but more science-based. And then when it came to NCLEX, it was strictly safety and knowing what they're asking. It was like a completely different style, but learning how to manage those. And then case studies, it was a pretty huge chunk of it. Every case study was around 6 questions, I think. So really taking your time with those and knowing what they're asking you. If you're not sure, don't pick it. If you're second guessing between two, which one sounds safer. And if you have no idea what they're asking you, come up with your best educated guess.
You ace it. I'm so proud of you. And now you're going to be doing your PULS, ACLS, and BLS and be spreading your wings to become one of the rock star bedside nurses. Am I correct?
Yes.
I'm so proud of you. Hello everyone. Welcome everyone. Today we're talking about one of the NCLEX most favorite patient population, which is older adult. Once again, welcome. We are live via Facebook, Instagram, and other social media platforms, and LinkedIn. And also, would like to emphasize that we're doing a live review right now. So it's free. It's free class review by courtesy of Past Review Center. So before we start, let's clear something up, right? getting older is not a disease, it's a privilege. So as they said, like you age like a fine wine, or what else? They're telling you that you're aging gracefully. That's also positive, um, adv- uh, positive comment from your by your friends. Thanks to stem cell probably. But although our knees may occasionally send strongly worded complaints, sometimes our knees can hurt as we grow older, and that's sign of aging. So the NCLEX loves geriatrics because older adults rarely come with just one problem. Instead, they come with what? Patient can come in with hypertension, diabetes, arthritis. What else? They could come in to the clinic or to the hospital with 8 medications. What else? You ask your geriatric patients, how many specialists do they see? Not only one, not only two, but sometimes they could have 3 specialists that they're seeing. Could be their pain management, could be their eye doctor, could be their foot specialist or podiatrist. And then also they could have a grandchild who Googled their symptoms. Or probably they have a chat GPT and they will tell you where they're coming into the hospital, and you'll be surprised by their most common complaints. So our job isn't to memorize every disease when we take our NCLEX, but it is to understand how aging changes. So we're looking at assessment, safety, medications, and priorities. So today we'll focus on what really matters for our patients. So we're thinking about safety, we're thinking about function, we're thinking about the quality of life of the patients. And those are the top 3 ideas that will help us manage our geriatric next generation questions. So let me just look at the chat box right now. Where are you guys coming from? Yesterday we did a live PMHNP review, and now we're doing a free live geriatrics next generation NCLEX edition. Lock it in live. So we have University of Luzon students. Welcome to our review and good morning to you guys in the Philippines. Hello po, magandang umaga po sa inyong lahat. And then in Pangasinan, Baybalin Agaw at Sikayan Amin. Did I say that correct? So welcome once again. Okay. Before I start, please type in into the chat box if you have questions about our review today. So once again, feel free to share, like, subscribe to our Past Reviews Center link so that you guys are up to date with our incoming classes. So every Monday and Friday, we reserve that day for the Psych NP students or anybody that wants to study about psychiatry. And then Tuesday, basically, we reserve that for the NCLEX Next Generation students. So remember, for NCLEX, it is 2 exam. You could be taking the LVN or LPN Next Generation exam, or it could be the Registered Nursing Next Generation exam. So we're gonna go over that today. So my objective is for you guys to be test ready for your NCLEX. So once again, welcome to Past Review Center. Tonight we're going through a realistic geriatric case study, and we're gonna use the 6 steps of the NCLEX Clinical Judgment Measurement Model. So are you guys familiar with that one? Once again, we're utilizing the 6 steps of the NCLEX Clinical Judgment Measurement Model. So before we begin, who among you have ever answered an NCLEX question and thought, I am 100% confident? Then you are reading the rationale and then you realize that the NCLEX is simply different in your aspects. And that's exactly what you can feel when you're taking your NCLEX. Sometimes there are questions there wherein you think that, oh, it's a hard question, but basically go over those rationales because they're highly important. So the NCLEX is like that one relative during your family reunions. Sometimes it can smile back at you, then ask questions that make you question your entire existence. So tonight we're going to beat that. We're not memorizing random facts. We're learning to think like safe nurses. And by the end of tonight, you'll be asking what have changed, what can hurt my patient first, that's very important. What should I do now? And how do I know my interventions actually work? And yes, I'll be checking in the comments, but no pressure. Just remember that the NCLEX exam is doable process. So before we begin, we have a very exciting news, and we're gonna welcome each one of you. For those who are tuning in once again, we have a very exciting news. So we are launching our official website, and please scan the QR code that you're seeing on the screen if you guys are new to our community. So our brand new Past Review Center website is now actually live. So you can create a free account and practice thousands of questions with rationals, videos, analytics, and board style exam questions. So we have utilized your artificial intelligence or AI and incorporated with innovation together with our new website. So please make sure do our board exam style questions. And you guys have the first hand experience of the beta testing. So doing 5,000 questions without reading rationals is like eating vegetables without chewing it. So technically you did it, but your brain didn't absorb it that much. So what do I tell my students is that always read the rational. We want you to understand the why because on the NCLEX, they don't ask you what did you memorize or did you memorize the concept areas. They ask, can you think of a big difference, which is your critical thinking. So remember that once again, NCLEX is big on critical thinking, big on safety, and big on what will you do best for your patient because our main priority is not to harm our patients. So remember that we have a very important role to heal the patients and not kill a patient. So that's the big difference. Right. Once again, where you guys are tuning in from, I'm going to check on the chat box from time to time. And if you guys have any friends that are taking the NCLEX very soon, let us support them. All students here are welcome. And for today, we're gonna do a next generation geriatrics case scenario. Okay. So before we meet our patients, we would like to emphasize what you need to remember for your geriatrics. So let's go back to the first slide. Sorry. Okay. So remember, there is normal aging versus disease. So remember, in NCLEX, they want you to remember the difference between normal aging and uh, abnormal aging, which is pathological disease. So remember, there is physiological aging and pathological aging. So when we talk about wrinkles, if you're gonna look at your patient, they have wrinkles. They are usually normal part of aging. Remember that, okay? So once again, wrinkles is normal part of aging. But if your patient have sudden confusion, then that's a pathological aging or pathological aging versus physiological aging. Hi, Lady. Welcome to the class. So remember, we're dissecting pathological versus physiological aging. Going to type in the chat box. So remember, when you have wrinkles, that's normal. Remember that? That's normal aging. When you have gray hair, that's normal aging too. When you have a slightly slower reaction time, then that's normal aging, right? And if you are reading the menu with your phone flashlight, that's also very normal. Right? So a lot of our patients can do that. But what is not normal, guys? Okay, what is not normal? These are the following: if you have sudden confusion, if you have chest pain, you have a new urinary incontinence, weight loss, or fever, then that's not normal aging. So remember that for your exam. Once again, normal aging, wrinkles, gray hair, and then slightly slower reaction time. They are completely normal. Then when we talk about not normal, these are sudden confusion, chest pain, urinary incontinence, weight loss, fever, and if they have acute weakness and if they have episodes of falling. So remember that that's not normal. So whether you see the word sudden on your NCLEX, your brain should light up. Older adults do not suddenly become confused because they're just old. So think about infection, medication effects, stroke, electrolyte imbalance, hypoxia, and if it's sudden or abrupt or acute, we gotta investigate. So once again, make sure guys remember that um, that's a normal aging versus abnormal aging. Now we'll put it into the chat box. So once again, know your pathological and know your physiological aging. So we'll put it into the chat box. All right. So remember those things that I've told you. So the key principle is to identify, is this normal aging or is it pathological aging? Okay. Now another key principle is to talk about delirium versus dementia. So number one, once again, we have to identify normal aging versus physiological or pathological aging. And then we mentioned that a while ago. Now we're gonna go to key principle number two. We gotta differentiate delirium versus dementia. So for those who are tuning in to this live section, we're talking about next generation geriatrics. Okay, this is a very specific NCLEX scenario questions that you guys will be dealing with. So let's differentiate delirium versus dementia. Which one is treatable and which one is not treatable? Which one is acute and which one is chronic? So once again, if you're tuning in, you should be able to answer this. So let's discuss delirium first. Delirium is, they are fast, they are acute, and they are reversible. So once again, when we talk about delirium, I will put it into the chat box. They are fast, they are acute, and they are reversible. So what do we mean by that? They are developed over hours to days, and then patient will just tell you, "I was fine yesterday," and today they're talking about, they're talking to the IV pump. Then that's delirium. Once again, delirium. The patient can be fine yesterday, and now you see them talking to their IV pump as if they're seeing things or hearing things. And that's basically not normal. That's delirium. So, what are the most common causes of your delirium? So, I will put it into the chat box so for you guys to follow. So, the first thing is urinary tract infection. So, a patient could have urinary tract infection. That's the reason why they could have delirium. Secondly, they could have coughing episodes, they could have infiltration under chest x ray, or they could have pneumonia. And very important right now, especially it's summer, the third cause is dehydration. So think about that one, dehydration. The next one is new medication. It could be a steroids or it could be an opioid medication, and surgery and pain. So, what is our important thing that we need to remember when we talk about delirium versus dementia? Remember, delirium, we have to treat the cause. So, we'll put it into the chat box. Delirium, once again, treat the cause. Dementia, on the other hand, they are slow, progressive, and chronic. So, we're differentiating delirium versus dementia. So, dementia, it is slow, it is progressive, and it is chronic. So delirium is fast, acute, reversible. Dementia is slow, progressive, and chronic. So remember, for dementia, our memory can slowly decline, our judgment can slowly decline, and our language can slowly decline, and our function declines, and it's not a sudden or overnight changes. So remember that for your exam, and I will put it into the chat box too. Dementia versus delirium. So think about delirium is days. Think about dementia, decades. So that's our memory trick for our exam once again. D stands for delirium. They could last for days. And then dementia, D for dementia, and they could last decades. It means it is chronic, it is slow, and it's progressive. So think about that memory trick. So once again, we go back to our ruling number one. Know your normal aging versus your pathological aging for your geriatrics question. Key principle number two, know your delirium versus dementia for your NCLEX. That's very important. Now let's go to key principle number three. We're gonna focus on this very important thing. Number three, key principle number three is focusing on falls. Okay, so if the NCLEX had a favorite hobby, it will be preventing falls. So every question that will ask you is how do we keep our patients safe? So what are the risk factors then for falling? So if you go back to your med surg concept area or your geriatrics concepts, these are the following risk factors. So please check your chalk box. They could have a poor vision, they could have a weak muscles, and they have sedatives, orthostatic hypotension, and then throw rugs, which is the true villains of geriatrics. Or they could have um, clutter. So remember, any clutter for geriatrics is bad because that can cause them to have falling episodes. So remember, your innocent rug could look very harmless on the NCLEX, but no rugs for your elderly because they can fall easily. So once again, absolutely um, no rugs for elderly patients. So how do we prevent falls, guys? I will put it into the chat box too. Remember, for your fall incidents, very important in the nursing home or skilled nursing facility, non-skid socks could be your priority. Call lights should be nearby. The bed should be at the lowest position. There should be adequate lighting for our patients and clear pathways. And then assistive devices, and then we really need to do hourly rounding. So once again, make sure you guys know your fall prevention interventions. Notice what is on the list. Um, those are the hot interventions that I want you guys to remember. So once again, make sure you guys know your fall prevention. And then what is not on the list? Physical restraints. So restraints increase the injury risk or increases the injury risk. So once again, do not answer physical restraints on the exam because restraints increase the injury risk for your patient. And they are the last option. And then we really want restraint-free environment for our patients. Next, so we did one, two, three. Our next key principle number four is medications. So let's talk about medications, guys. So remember number one, number two, number three, and number four. Our number four is medications. So our older adults don't process medications the same way as younger population does. So our liver slows down, the kidneys will slow down, and body fat increases, water decreases, so the medications stay around longer for our patients. So what will be the translation for that? The same dose can have much bigger effect for our patients. So a lot of our elderly patients will be prone for toxicity. So what are the NCLEX high yield medications that we need to remember? So I will put it into the chat box. So make sure we watch out for benzodiazepine. Remember, they are not good medications for our elderly population. So if they are on Klonopin, Xanax, if they're on Ativan, benzodiazepine will increase risk for falling and high risk for dementia. So we gotta watch out also for opioids, for pain medications, anticholinergics, and sedatives. Why are we watching out for these medications, guys? Because the following medications, you are at risk for falling, confusion, constipation, and urinary retention. So always ask, could the medication be causing this problem? So your NCLEX will tell you which of the following medications should we be very careful about geriatric population. So remember your benzos, opiates, anticholinergic, and sedatives. So what will be your mnemonics? BOAS. So remember your BOAS are not good for your elderly patients. So what is BOAS? Benzodiazepine, opiates, anticholinergic, and sedatives. Especially if they have benign prostatic hyperplasia, do not give them Benadryl or anticholinergic because that will put them into urinary tract infection. So always remember your BOAS. Your BOAS, BOAS, you are prone for falling, confusion, and constipation and urinary retention. Next key principle number 5 is polypharmacy. So when we talk about polypharmacy, poly means many. So they are on different medications, or polypharmacy means many medications. So some older adults have medication lists longer than the restaurant menus. So the nurse should always review their medication. So remember that if they're in polypharmacy, we really need to do a medication reconciliation. So is there a duplication of their medication? Is there a drug interaction? What are your over-the-counter medications? What are your herbal supplements that your patient is taking? So never assume every prescription still needs to be there. So as a role of the nurse, we really need to do a medication check, review, and always inform the provider. So remember that. Next key principle for geriatrics is number 6 will be focusing on pain. So just a recap for your patient, older adults feel less pain. So that's false. So that's a myth. So remember, older adults, they feel less pain, and that's not a true statement. Pain is not a normal part of aging. So always assess for pain, believe what the patient tells you, and then we have to treat it appropriately. So remember, your untreated pain, what will it do for your patient? So if the pain is not treated, it will lead to delirium, falls, poor mobility, depression, and then also very important will be the screening for your pain for your patient. So once again, pain is not normal part of aging, and I will put that into the chat box. Remember, pain once again is not a normal part of aging. We have to address it, and then we need to make sure to rule out what's causing the pain. Okay. Next, we talk about key principle number 7 for our older population. We have to focus on their skin. As you know, older skin is thinner, they are less elastic, and they are more fragile. So the pressure injuries happen quickly for our patients. So what will be our intervention for skin for our patient? Especially for elderly guys, we need to reposition them every 2 hours. We need to make sure we focus on their nutrition, right? We're looking at protein diet for our patient, and then also hydration, moisture control. We have to tell and our caregivers, our CNAs, LVNs, or whoever's taking care of our patient to do a moisture control. And then also pressure relieving surfaces. So the skin tells a story. We have to pay attention to it. Because what's going to happen if we are not addressing that, we are not repositioning our patient, we are not addressing nutrition, we are not addressing moisture control for our patient, then the more pressure ulcer that the patient will have. Okay? So think about that. Next, key principle number 8. We gotta focus on nutrition and hydration. So remember nutrition and hydration once again for our geriatric population. So older adults, they often eat less because they have poor dentition, they have dentures. What else? They have decreased taste. Sometimes they will tell you, I don't like the food, it's so bland. So they want to have more salt on their diet. What else? They have limited income. So before they are earning a lot, but as part of retirement, they will have a limited income now. So they have difficulty cooking. Sometimes they have rheumatoid arthritis or mobility issues. So they are not capable to cook their own meals, or they have depression. So remember, older adults may not feel thirsty. So dehydration can sneak up quietly. So we have to watch out for confusion, dry mucous membrane, dark urine, hypotension, tachycardia, and always remember that hydration matters. So I'll put it into the chat box. So once again, we have to monitor for confusion, dry mucous membrane, dark urine, hypotension, and tachycardia. Next, our key principle number 9 is therapeutic communication. So if you're taking the NCLEX, you need to be master of your therapeutic communication. So never talk to older adults like children. So when you are talking to them, do not treat them like children. You need to be respectful of your communication, and instead of you shouting, they are they are more respondent to low tone of voice. So do not shout at your patient. Lower background noise. Face the client, speak clearly, and allow time to answer. And then the goal isn't louder, and the goal is clearer. So remember number 9, therapeutic communication is necessary for them. So when the NCLEX asks who do you see first, you have to choose older adults with acute confusion, sudden weakness, chest pain, difficulty breathing, new neurological symptoms, and the signs of sepsis and chronic problems will wait, and then acute changes will win and always. So remember that. Once again, you focus on the abrupt symptoms. So once again, acute confusion, sudden weakness, chest pain, difficulty breathing, new neurological symptoms, and signs of sepsis are priority for aging. And I will put it into the chat box. All right, let's apply what I had discussed in a scenario. Let's meet our patient now. So remember, they're big on delegation. Always delegate stable, routine, predictable tasks, keep assessment, teaching, evaluation, planning, and unstable clients with the RN. And always remember, do not delegate what you cannot eat. So anything with evaluation, assessment, and teaching, we gotta be careful when we delegate that as a registered nurse. So make sure, guys, you are a master of delegation. Right? I guess we need to do a separate section for that. So let's meet our patient now. So before meeting our patient, let's remember the NCLEX next generation golden rule. Always safety first, feeling second, and then teaching will be later. So think of this way: if your patient's bed is on fire, you don't hand them a pamphlet about fire safety. You put out the fire first. So always think about safety. So sometimes students choose patient education because it sounds nice, but the NCLEX says that's adorable, but save the teaching until the patient survives. So once again, when there's a question about safety, always save the patient first before teaching them. So think about protecting the life first of your patient. Teach later. Education is always important. Breathing is slightly more important. So remember that one, okay? When there's fire, save the patient first before teaching them about fire. Right? So let's meet our patient now. If you look at the chat box or if you look at the slide, let's meet our patient, and her name is Eleanor James. So she is 82 years old and she's coming into you with hypertension, osteoarthritis, urinary incontinence, and mild hearing loss. So this is how the NCLEX next generation is presented to you. Those are chronic conditions. So once again, she's 82 years old. She has chronic conditions. So think of them as your old roommates. They've been around, so they aren't the new problem now. She takes diphenhydramine for sleep. Whenever I see diphenhydramine in an older adult, my nursing brain immediately says, oh, this patient is taking diphenhydramine or Benadryl, and this diphenhydramine has a special talent. It helps the people sleep. And sometimes they help them forget where they are. So this is a red flag for elderly patient. So not exactly the retirement plan that we wanted. So her daughter found her on the floor 2 days ago and she was independent. Now she's very confused, and that phrase will change from the baseline. So it's one of the loudest alarms in the NCLEX when an older adult suddenly changes. Don't blame their age. Age is innocence until proven guilty. Once again, in NCLEX, age is innocent until proven guilty. So if you're looking at this particular scenario on the NCLEX, you always look at the client information. Once again, she is 82 years old. She is in the medical surgical unit. She has hypertension, osteoarthritis, urinary incontinence, and have mild hearing loss. So, very important for your NCLEX is to think about how you can handle your patient well. She is on lisinopril. So what do you mean by lisinopril, guys? Pril are ACE inhibitors. So basically, anybody who is on lisinopril, they have a side effect of chronic cough. So we have to make sure to deal with that. Hydrochlorothiazide, hydro guys means water. So we're thinking about diuretics. So they are on hydrochlorothiazide. So this is thiazide, which is a diuretic. So we're thinking about dehydration tendencies for a patient. Now they are on acetaminophen too, 650 milligram. Always think about acetaminophen for your NCLEX. They could have hepatotoxicity. Now, if the patient is on aspirin, they could have tinnitus. So think about acetaminophen, hepatotoxic. They could have liver damage. The next is diphenhydramine, 25 milligram orally at bedtime as needed for sleep. So the presenting situation of the patient, the client's daughter brought her to the emergency department after finding her on the bedroom floor. And the daughter reports that the client is normally independent, manages her own medications, and is oriented to person, place, and time. And during the past 2 days, the client has become increasingly confused. They have eaten very little and has complained of urinary urgency and burning. And the daughter states she took something to help her sleep last night, but I'm not sure by how much. So once again, this is a very typical NCLEX next generation geriatrics case scenario. So now we are familiar with Eleanor James. That's our patient. And then now we're looking at the vital signs and laboratory results of the patient. Okay. So if we're looking at the nurse's notes right now, what do you see, guys, on the nurse's notes? So on the nurse's notes, at 8 o'clock, the client is awake but restless, and she repeatedly asks, when are we going home? The client is oriented to self but not to place, time, or situation. The speech is very clear. The mucous membranes are dry and a strong urine odor is noted. So the client attempts to get out of bed without assistance. Now at 8:30, the client reports suprapubic discomfort and burning with urination, and then a 4 centimeter bruise is present over the right hip of the patient. And the client can move all extremities but reports right hip pain rated 5 out of 10 with movement. And then the vital signs are as follows. So temperature is 38.2 degrees Celsius, and then heart rate is 104 beats per minute, respiratory rate is 20 per minute, blood pressure is 98 over 58 millimeter mercury, and the oxygen saturation is 96% on room air. Now we're looking at the lab results of the patient also. White blood cell count is 14,800. This is something out that is abnormal. And then the sodium is 130 milliequivalent per liter. We know that sodium is 135 to 145, so this is a low sodium. The white blood cell count is elevated, 5,000 to 10,000 will be your normal. And then the potassium is 3.4 milliequivalent per liter. And we know 3.5 to 5 will be your normal. BUN is 34 milligrams per deciliter. And then the creatinine is 1.3. Urinalysis is positive for leukocyte, esterase, nitrites, bacteria, and white blood cell count. So for those who are tuning in to this live session, if you're looking at the nurse's notes, guys, what can you look at in the assessment? We're collecting our clues for this particular patient, right? She is confused. She is dehydrated. She has a fever and she has a low blood pressure. She has a fast heart rate. She has burning with urination, positive urinalysis, low sodium, elevation of her white blood cell count. And at this point, the NCLEX isn't dropping hints anymore. It's practically waving glow sticks at you. The patient is saying, notice me. When multiple abnormal findings point in the same direction, please don't chase one clue. Connect the dots. So once again, if I'm testing for my NCLEX, gotta make sure that I was given this assessment. I gotta make sure I have to do something about it. So once again, click on the chevron, nurse's notes, click on the chevron again, vital signs, click on laboratory results. That is very important, guys, when we're testing for an NCLEX. Each section on your NCLEX for next generation will give you a background of the patient. So the subjective and objective data is important. Subjective is whatever the patient says. Objective is whatever you saw and whatever is measurable. Remember, sign is subjective. Uh, Sign is objective and symptom is subjective. Remember that the song I saw the sign. So sign is objective, symptom is subjective. Once again, make sure to remember that. So let's proceed. Now, you'll be given a question which is select all that apply. So for those who are tuning in to this live session, it's time for our first question. Select all the findings that requires follow-up for your patient. So select all the apply means SARA. So select everything that sounds medical is not correct. So we need to make sure that we know what SARA stands for. Select all that apply. So some students answer SARA like they're ordering everything from the menu. So the NCLEX says no, evaluate each answer independently. Pretend each option owes you money. So make it prove it itself. So let's look at the first scenario, right? So is it select all findings that require immediate follow-up by the nurse? Is it letter A? Does this require immediate follow-up? Letter A, acute change in orientation. So is it a true or false statement? Letter B, if they have a dry mucous membrane, is that a true or false statement? Does that require follow-up? Letter C, temperature of 38.2 degrees Celsius. Does that require follow-up? True or false? Letter D, osteoarthritis history. Does that require follow-up? True or false? Letter E, blood pressure of 98 over 58 millimeter mercury. Is it a true or false statement? Letter F, positive urine nitrites and leukocyte esterase. Does that require follow-up or does that not require follow-up? Now, if a patient has mild hearing loss, does that require follow-up or does not require follow-up? And letter H stands for sodium of 130 milliequivalent per liter. Does that require follow-up or does that not require follow-up? So drop in your answers, guys, into the chat box. So remember, do not be overwhelmed with select all that apply. A lot of students says, oh my God, select all that apply is so hard. But once you know how to answer them, I treat them like a true or false statement. Is letter A applicable or not applicable? Is letter B not applicable or not applicable? Letter C, letter D, letter D, E, F, G, H. So please type in your answer into the chat box. I'll be giving you enough time to type it into the answer. So notice something, the NCLEX isn't asking, can you recognize arthritis, right? But it's asking, can you recognize danger? That's what nurses do every shift, right? So once again, we have to recognize what is abnormal versus expected or unexpected finding. All right, University of Lausanne, if you're here, please type in your answer into the chat box. So are they Alpha, Beta, Charlie, Delta, Echo, France, Georgia, or Homer? So A, B, C, D, E, F, G, or H. I'm looking at answers right now. So for those who are tuning in into the Philippines, hello and welcome to this live session. This is absolutely free. We wanted to support the students that are taking the NCLEX very soon in this platform. So please make sure to like, share, subscribe, or tag your friends that are tuning into this session. All right. So the answers are, don't be shy. So we're looking at the answers. All right. So very good. So A, B, C, E, F, and H. So why are these answers, guys? So remember, if you're doing practice questions, it's not enough that you get the right answer, but you always need to make sure to read on the rationals. So the client has an acute change in mental status, and that's basically important. So remember, if there's episodes of change of orientation, that's a red flag sign that there could be locking of oxygen into i- the lack of oxygen into the brain is very important. So if they are restless, they're anxious, they are tachycardic, or they're tachypnic, that's an early sign of low oxygen in the body, or you call that hypoxia. So this suggests delirium rather than normal aging or chronic dementia. So A is correct. Your fever, your hypotension, abnormal urinalysis, and leukocytosis, they suggest your urinary tract infection. So that's not normal. And they have a possible systemic involvement. If you don't treat UTI, it can lead to complications such as sepsis. And then later on, this will lead to septic shock, and then from septic shock, this will lead to multiple organ dysfunction syndrome. And then after that, your patient may be experiencing sudden death. So think about those domino effect of complications. So dry mucous membranes and an elevation of your BUN indicate dehydration. Hyponatremia, remember the normal sodium is 135 to 145, and the NCLEX will usually give you the normal levels for that, and they can worsen confusion and then at risk for fall. Osteoarthritis and mild hearing loss are chronic findings and not the most urgent concerns. So remember the following red flag symptoms, okay? And objective findings that we need to remember. Hot topic on your board exam, right? So once again, in your NCLEX, it's not how you remember everything, but it's how you understand and apply the content. So let's look at this mnemonic. Our mnemonic is the fluid, not OH. So remember, think about the fluid. So what is letter D? D stands for delirium. They could have acute confusion. So if you ask them where they at right now, or what is the date today, can you tell me the season today, who is the current president? So any change of orientation, guys, we really need to make sure to rule out what's causing that. So, or you could have a patient that will walk into the nursing station and they could be what naked. So your patient will be walking on the hallway and they're naked, and it means that they have acute confusion, and that could be delirium. So we really need to run some tests, call the provider so that they can run or rule out is this substance induced, or they could have a UTI. Letter F stands for fever. Any fever, we need to investigate and assess further. Letter L, if they have a low blood pressure, that's very important. Letter to rule out, especially remember hot, drop it like it's hot, hypotension, oliguria, tachycardia, tachypnea are red flag symptoms. They may be symptoms of impending shock. The letter U stands for UTI, urinary tract infection. So in Filipino, we have this humor. You have UTI, umibig tapos iniwan. So if you have UTI, means you love somebody and then somebody left you right away. So that's UTI for Filipino humor. Umibig tapos iniwan. I hope for all the listeners out here, you will not have UTI, wherein you love someone and then left you behind. umibig, tapos iniwan ka lang bigla sa ere. Masakit yun ah. And then you have a letter I, insufficient fluids. So that will be your dehydration. And then letter D, you will have a decreased sodium, which is 135 to 145 will be your ballpark. So if you have a low sodium, that will also lead to decreased sodium leading to increasing fall. So remember, if you have a low sodium, hyponatremia, you will be at risk for fall. Now we have ignored osteoarthritis. Now osteoarthritis in the board exam will focus on weight-bearing joints. So the patient will have what? Pain here on the knee, on the elbow. So any weight-bearing joints, we need to make sure that we support our patients if they have osteoarthritis in terms of their mobility. And then also think about your Bouchard's nodes and then also your Heberden's nodes. Okay? Hearing loss, think about your hearing loss, presbycusis, presbyopia if it's abnormal curvature of the lens of the eye. Presbycusis, guys, is that they are not able to respond to high tone of voice. So they can only respond to low tone of voice. So do not shout at your patient. So remember the mnemonics, the fluid and not OH. So think about that mnemonics once again, the fluid and not OH. All right, I hope you guys are learning from this session. So once again, in NCLEX Next Generation, they can give you a case scenario, and then they're gonna give you another question. So make sure you are following this review really well because it will give you an idea what you're gonna expect for your NCLEX Next Generation. So we have to complete the sentence by selecting the most appropriate options. So the client's acute confusion is most likely caused by blank, as evidenced by blank and blank. So the NCLEX can look like this. We analyze the cause. So what are the potential findings? Letter A, Alzheimer's disease. Letter B, delirium related to infection and dehydration. Letter C, does the patient have major depressive disorder? Or letter D, is this a normal age-related cognitive decline? So once again, the client's acute confusion is most likely caused by blank. So you have to choose between A, B, C, and D. And then as evidenced by blank and blank. So what are the supporting findings? Gradual memory decline over several years. That's letter A. Letter B, sudden change in mental status. Letter C, positive urinalysis and elevated white blood cell count. Letter D, long-standing hearing impairment. And letter E, chronic osteoarthritis pain. All right, once again, if you're testing your NCLEX, it's really important, guys, to be aware of the NCLEX Next Generation test plan. And this is an example for that one. Now, let's analyze what caused the confusion. The students often see confusion, then immediately picks dementia right away. So the NCLEX quietly says, read the timeline. So what is the timeline? 2 days, not 2 years. So that will be your clue. Once again, you look at the timeline, 2 days, not 2 years. So think about that one. So is it Alpha, Beta, Charlie, or Delta? So type in your answer into the chat box, guys. So are you ready to take your NCLEX? Yes or yes? All right. So remember, is it Alpha, Beta, Charlie, or Delta? So remember, the purpose of this session is to be familiar with what you're gonna encounter for your exam. So it's very important, guys, to be actively engaged. And if you're tuning in, please try to answer. There's no judgment on this section. That's why we're all here to learn so much about geriatric concepts. All right. So what is the answer? So if we're looking at the question, you need to rule out that delirium typically develops suddenly and they fluctuate during the day and is commonly triggered by infection, dehydration, medication. I think we talked about that a while ago. Electrolyte abnormalities, pain, and hospitalization. Remember, dementia usually develops gradually and is not characterized by abrupt change from the baseline. So what will be the answer for that one is that we're looking at delirium. This is delirium. This is sudden, this is reversible, and usually caused by something. So think about delirium as your patient is waving a giant flag saying, something is wrong. Dementia, though, is different. Dementia is like someone suddenly changing the TV channel, and then dementia is the TV gradually getting older. So, completely different stories for your patient. So once again, delirium is sudden, abrupt, they're acute, they are treatable. Dementia is chronic, they are progressive, and they are not treatable. So, make sure, guys, you know delirium versus dementia. Okay? And then the next slide, we'll talk about Swift. So, who are fans here of Taylor Swift? If you are a Swiftie, remember Swift for delirium. So, they are sudden, they have waxing and waning, they could be caused by letter I, infection. They could also be caused by letter F, dehydration or fluids. And then also letter T stands for toxins or tablets. So they could be caused by medication or electrolyte imbalance. So the key point for your NCLEX is delirium develops quickly and has a treatable cause. So we're looking at SWIFT. So if you are Swifty, think about it can develop abruptly and delirium comes swiftly. So think about that one. So once again, think about SWIFT when you take your NCLEX. Those are the most common factors that you could have delirium or characteristics of delirium. So when students remember SWIFT, their NCLEX scores usually become well. So a little more SWIFT. So you have to make sure you know the timeline for your delirium. Remember that once again. Next slide, we're going to talk about the priority. So we have to prioritize hypothesis. So which client problem should the nurse address first? So which one should we address first? Letter A, do we address risk for impaired skin integrity? Letter B, acute confusion with high fall risk. Letter C, chronic osteoarthritis pain. Or letter D, knowledge deficit regarding medications. So is it letter A, letter B, letter C, or letter D? Okay. So remember, prioritization is important. Which problems comes first? Here's what the NCLEX becomes very dramatic. Everything matters. Sometimes you will be thrown off like, oh my God, which one is really priority? But of everything that matters first is think about emergency room. Who's getting seen first? Is it the paper cut, somebody with paper cut, or the person trying to climb out of bed while confused and hypotensive? So exactly, you really need to prioritize your patient. So is it Alpha, Beta Charlie, or Delta? So which one is our priority? Very good. Everybody answered letter B. So the priority answer is acute confusion with high fall risk. So think about that one, right? If safety always wins on the exam. So the client is confused, restless, hypotensive, hyponatremic, and will repeatedly attempt to get out of bed. So this will put them at risk for falling and another serious injury. So safety takes priority while the nurse also address the underlying infection and dehydration. So our secondary concern will be chronic pain, skin integrity, and medication teaching. So they are important but not the highest priority. Once again, think about acute confusion. So for your exam, safety always wins. So what will be our mnemonics when we talk about safety, guys? Think about crash. Remember, crash landing on you. So think about C. If they are confused, this is a highest priority, guys, on your NCLEX. If they are restless, guys, this is highest priority on your NCLEX. If they're trying to attempt to get out of their bed, They will be at risk for falling, so that's also priority. When their sodium is low, remember the song low, 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 low. 135 to 145 will be your normal sodium level. So this will be your hyponatremia. They will be prone for falling. Letter H stands for being hypotensive. So if your patient is doing all five, you don't walk away saying, I'll come back after lunch. You have to stay engaged with your patient. Once again, if you see crush on your patient, don't say, okay, I'm going to come back after my lunch break. You have to make sure you watch out for this CRASH. If you see them on your NCLEX, they are your highest priority. Once again, priority is important with your NCLEX, and you could be faced with this particular scenario. All right, let's talk about generating solutions. So what did you notice, guys? Our NCLEX is doing the 6 steps judgment model, NCLEX next generation judgment. So for this particular question, we are generating solutions. Which intervention should the nurse include in the plan of care? Another select all that apply. Letter A, placing the client near the nurse's station. Letter B, applying wrist restraints when the client attempts to stand. Letter C, do we provide frequent orientation using clocks and calendars? Letter D, will we keep the bed in the lowest position? Will we do letter E, encourage the client to use her hearing aids? Letter F, turning off all lights and keeping the room dark during the day. Letter G, do we assist the client with scheduled toileting? Letter H, do we review the client's use of diphenhydramine or Benadryl? In the NCLEX, they use the generic, guys, okay? Generic name over brand name. Or they can use both, but generic is always standard. Letter I, encourage oral fluids if not contraindicated. So once again, NCLEX Next Generation will give you SARA questions, select all that apply. Make sure you're not going to have anxiety and it's very doable. All right, let's think about generating solutions. Let's choose interventions. Notice something, the best interventions are often, usually they are boring. So one thing that I'm telling you, the best interventions are usually often boring. Like what are examples of that? They could be low bed, call light, orientation, hydration, hearing aids. So once again, NCLEX loves simple, safe interventions. So think about simple, think about non-invasive, before invasive. So before you push medications, think about simple, cost-effective interventions. So it is options that are not fancy. It isn't always looking for fancy options. Sometimes greatness looks like helping someone safely to the bathroom. So let me reveal the answers. Drop in your answers, guys. And if you're tuning in from the Philippines, good morning in the Philippines. Good evening if you're in California. And then if you're tuning in from New York, almost good night because it's 10 p.m. in New York right now. So what are the answers? Remember, select all that apply. Do not have anxiety. You got this. So what is the answer? So your answers are your letter A, your letter C, letter D, letter E, letter G, letter H, and letter I. So think about restraints is very invasive. We want a restraints-free environment for our patient. Restraints, guys, will cause your patient to have more fractures. So always remember restraint is last resort and always not the best answer because restraints will increase agitation, will cause them to have injury. They will try to move more, and then that will lead to fractures, wrist fractures. And then they should not be used routinely. It's always last resort. Maintaining normal daytime lighting can help regulate the sleep-wake cycle and reduce delirium. So why Benadryl or diphenhydramine is important with your NCLEX? They have strong anticholinergic effects and they can contribute to confusion, urinary retention, sedation, and falling in older adults. So remember your diphenhydramine, they could not see, they could not pee, and they could not poop. So can't see, can't pee, can't poop. So constipation, urinary retention, and of course, blurring of vision can happen for them. And acute confusion. So remember that for your NCLEX. All right. Everybody got the correct answer, right? So think about the mnemonics, refresh and not rud. So what do you mean by refresh? These are your good nursing care. You gotta reorient your patient. You have to tell them where they at. Letter E, we have to ensure that there's a safe environment, right? We need to make sure that the bed is in the lowest position. Fluids, if they're dehydrated, they have more acute confusion. Letter R, review the medication. We always do med review or medication reconciliation, particularly if they have polypharmacy, especially for geriatric population. Eyes and ears are very important. As we know, they could have problem with presbyopia or presbycusis. Next, schedule toileting. This is very important, right? To prevent UTI, we need to make sure every 2 hours we pee or empty our bladder. And letter H stands for help with sleep with normal daytime light. So think about a lot of elderly patients struggles with sleep. So it's very important to establish a routine, daytime and nighttime routine are very important for them. And avoid RAD. What is RAD? Make sure do not put your patient on restraints. No anticholinergics for geriatrics. Diphenhydramine or Benadryl are culprit for that. And then dark, make sure daytime environment, make sure they can still see their environment. They're at risk for falling. So remember, think about that one. Our priority will be avoiding restraints. And if they're climbing out of their bed, that's our priority. And then also least restrictive interventions. So remember that once again, least restrictive interventions. So a confused patient tied to the bed usually becomes an even more confused patient tied to the bed. So remember, do not restrain them. Okay, last resort. Right, let's move on to the next. Now we're looking at evaluation of outcomes. After receiving a prescribed intravenous fluids and antibiotics, which findings indicate the decline condition is improving? Select all that apply. So a lot of students always struggle with select all that apply, and NCLEX next generation questions can look like this. So we're trying to mirror the actual exam by giving you guys options and scenarios like this. Letter A, the client correctly states her name and location. Is the client improving? Is this a true or false statement? Letter B, blood pressure increases from 112 over 68 millimeter mercury. Letter C, urine output is 35 ml per hour. Letter D, client continues attempting to climb out of bed. Letter E, temperature decreases to 37.4 degrees Celsius or 99.3 degree Fahrenheit. Letter F, sodium decreases to 127 milliequivalent per liter. And letter G, the client follows instructions to use the call light. Or letter H, the heart rate remains 112 per minute. So Alpha, Beta, Charlie, Delta, Echo, France, Georgia, or Homer. So think about A, B, C, D, E, F, G, H. So we're looking at implementation for your patient, right? So type in your answer into the chat box. Do not be shy. That's why we're all here to learn about your NCLEX next generation scenario. All right, let's reveal the answer. All right, so these are the correct answers. Okay. So letter A is a correct intervention. Client correctly states her name and location. So this is improvement. What does it mean by that? A better orientation and safety awareness and stabilization of the blood pressure, which is your letter B, indicates a resolution or improvement of perfusion for your patient. So once again, A, B, letter C is also good. We know that the normal urine output is 30 to 50 an hour. So this is good. Letter E, the temperature also signifies a good outcome. And then letter G, client follows instruction to use the call light. That's also good outcome. So these findings, they suggest improved hydration, perfusion, infection control, and mental status. They are very big on your NCLEX. So continued attempts to get out of bed if they have a worsening hyponatremia, if they have a persistent tachycardia, they indicate that it requires further treatment, and we really need to investigate it further. So once again, for this particular scenario, right? Um, which findings show improvement? The translation is, did your interventions actually work? So because nursing isn't I did something, and NCLEX will usually ask you, did it help? So once again, in NCLEX, it's not like I did something for the patient, but the NCLEX will actually help you or question you, did it actually help? And those are the evaluation techniques that we need to remember. Okay, almost done, guys. Our next scenario is the mnemonic improving versus not improving. So think about this mnemonics. If you're improving, our mnemonics is O PIMS. So what is O PIMS? There is improvement with orientation. There is improvement with hydration. There's improvement with perfusion. There's improvement with infection, and they're improving. And there's improvement with mental status, and there's improvement with safety. So remember O PIMS. They are not improving if they are developing the three T's. What are the three T's? Trying to climb out of bed unassisted, they can fall. Their heart rate's still up, that's tachycardia. And if they have too low sodium, so hyponatremia. Remember 135 to 145 as your sodium, normal sodium level. So think about the improvement. Better blood pressure, better orientation, lower temperature, adequate urine output, using the call light, that's improvement. Remember, one normal number doesn't mean that the patient is getting better. Patients are not math problems. Look at the whole picture of the patient. So once again, patients are not math problems or algebra or calculus. We have to look at the whole picture of the patient. Right. Let's go to the next slide. So remember, this is your NCLEX next generation scenario. Let's look at acute change or cognition in an older adults. So an acute change in an older adult is not a normal part of aging. And I think I mentioned this a while ago. If there's sudden confusion, search for the cause, investigate, and also assess further and treat it. So what are the most common reversible causes? So we have your infection, and we know that the white blood cell count will actually rule that out. So if they have increased white blood cell count, that will signify infection. Dehydration, if they have UTI, electrolyte abnormalities such as your sodium. It can also be found with your potassium. Medication effects, hypoxia, your pain, your urinary retention or constipation. So our priority sequence for our older adult is we have to protect the client from falls and injury. Identify and treat the underlying cause, provide hydration and sensory support. Especially some of the dementia patients will not tell you if they're thirsty or hungry. And then use frequent calm orientation and avoid unnecessary restraints and high-risk medications. So this will be in the form of like opiates, your benzodiazepine, and then also your anticholinergic, and also your sedatives. Okay, so remember your BOAs. Okay, so think about this acute change. Always think about what happened with Eleanor. Eleanor didn't suddenly become old, she became acutely ill, and that's a big difference. The nurse should always recognize the cues and connect the clues. Protect the patient, treat the cause, evaluate the outcome. That's the clinical judgment that I want you guys to develop. Okay? So think about that one. Acute confusion. Think about delirium first, okay? Remember that. All right. And then think about again our new website, guys. It's available for you. This is very important. And excellent work tonight. Give yourselves a round of applause. Seriously. If you made it through nursing school, you did a lot of your clinical hours, you did care plans, pharmacology, select all the reply questions. You are tougher than what you are thinking right now. I salute you because not everybody could survive nursing school. You are the cream of the crop. Next thing you know, I'm your patient, or my loved ones will be your patient. And that's why we always need to make sure that we're providing quality, educated, and also evidence based practice with our patients because you guys are the next generation of nurses that we're providing. So, NCLEX isn't trying to trick you. So, what you have noticed today's session is focusing on safety. You have to think critically, guys. Trust your training. Do not depend on what you saw from the clinicals, guys. Trust your training, but always by the book and what is evidence based. Sometimes what we saw by our clinical practice are shortcuts. So that's the most common pitfalls of passing the NCLEX. So make sure by the book. You have to practice every day, guys. Do practice questions and scan the QR code. Our our website has practice questions and resources. And we have a community that we're developing. So we have Facebook, Instagram, and LinkedIn community. And also always remember that if this review helps you out for today, please continue to share it, like, subscribe. We have a YouTube channel and we have a weekly session. Monday is Psych NP and Friday we have a free session by Professor Ladi and me. And then Tuesday, I usually hold this NCLEX next generation topic by topic, core NCLEX topics that you need to remember. And may you all be future NCLEX posters, but obviously it needs a lot of work. And I strongly believe that you trust the process. It doesn't happen in one day. And always remember that take your NCLEX seriously because we want to treat this seriously because you are preparing to take care of real patients. I can be your patients next, my mom or my loved ones, and we really want you to be the best nurse that knows their stuff and are safe enough to practice. So once again, I'm rooting for you. Take care of each other, take care of your own mental health. Please listen to our podcasts for Mindful Moments with Pedro Morante every Saturday. And we are on year 2 of our podcast. So thank you so much for the support and take care of each other. Thank you. Bye bye. See you in the next live.